Hello, my name is Dr. Howard Robinson, Alabama State University archivist and historian. I am moderating today's program, which reflects the 2021 theme for Black History Month, Black Health and Wellness. The title of today's program is COVID-19 and the African American Community, Moving Beyond Mistrust and Misinformation. By the way of introduction, I would like to say that African Americans have had a long history of mistreatment within the medical establishment, from James Marion Sims, who experimented without anesthesia on enslaved Black women here in Montgomery, Alabama, to the infamous Tuskegee syphilis study, where for decades effective treatment was withheld from hundreds of Black men so that researchers could track the course of the disease over time. Dr. Laura Bogart, a social psychologist and senior behavioral scientist at the RAND Corporation, found that medical mistrust is not just relegated to past incidents of mistreatment, but also stems from the discrimination African Americans have experienced in today's healthcare system. An article published by the Harvard Global Health Institute in 2013 cites a study of 222 white medical students and found that nearly half, or actually 60%, erroneously believed that African American skin was thicker and that their nerve endings were less sensitive. The National Library of Medicine published a survey showing that almost half of white doctors in the survey believe that African Americans are more tolerant of pain. Other studies found that white physicians registered a preference for white patients, and they believed that the Black patients were less intelligent and less likely to follow professional advice. Consequently, these factors and other lived experience are reflected in a November 2021 Pew Research Center survey that found only 42% of African Americans said that they'd be willing to take a COVID-19 vaccine. Today's discussion will last about an hour and will address COVID-19 and its impact on African Americans. We will explore COVID-19 misinformation, give some context for vaccine hesitancy, and identify strategies to combat the COVID-19 virus amongst African Americans. Before that, I hope we have a message from our president.
Greetings. As the 15th president of Alabama State University, I am happy to welcome you to this special program that honors Black History Month and the rich legacy of African Americans. I want to thank the National Center for the Study of Civil Rights and African American Culture at ASU for hosting this program. Our center serves as a repository of information relevant to the study of civil rights and the culture of African Americans. In keeping with the 2022 National Black History Month theme of Black Health and Wellness, This program will examine issues surrounding COVID-19 and the African American community. We invite you to learn from the outstanding healthcare experts and program participants who will discuss this important and relevant topic. I would like to thank the National Center Steering Committee under the direction of Project Director and Dean, Dr. Janice Franklin, and today's moderator and historian, Dr. Howard Robinson, for their work in hosting this program in celebration of Black History Month. Thank you for your attendance this evening and for your ongoing support of Alabama State University. I encourage you all to stay aware, stay safe, and stay Hornet strong.
Our panelists include Dr. Pamela Foster. She is a professor and deputy director for community outreach with the Community Medicine and Population Health and the Institute for Research and Health. The Institute of Rural Health Research at the University of Alabama. Ms. Felicia Barrow, interim director for the Office of Health Equity and Minority Health in the Alabama Department of Health, Public Health. Dr. Joyce Lloyd Davis, senior director of health services here at Alabama State University. After the panel, we will take questions from the audience. So throughout the discussion, post your questions in our chat box, and we will address as many questions as possible. Okay, before we turn to our panelists, we wanted to get some sort of man on the street observations. In this case, we talked to Alabama State University students and asked them a series of questions to understand how they see the COVID-19 pandemic, their views on vaccination, and their thoughts about the information and or misinformation about COVID-19. These comments will help inform our discussion with our medical experts. You'll see the questions posted on your screen, and then you'll hear the students answer those questions. So let's turn to our first question.
I am vaccinated. I got the Johnson & Johnson. Reason why I got the vaccination was so I could be able to travel with the band to different states to go against different teams for the fall season.
Yes, I actually just got vaccinated my first dose January 30th with the Pfizer shot at Walgreens.
Okay.
Just so I can be back with my family and spend time with them, because they were the first people who I know who got COVID. So
honestly, at first I was a little hesitant, but after a while I figured that it was good for my safety and my health, for my family and myself and others around me. So I got it, and also for my career as well. I'm trying to be in the entertainment industry. It's most likely required for you to be vaccinated, so I went ahead and got it.
I feel like it could get better if people listen. Some people stay home. Others, if you are vaccinated, keep doing what you're doing. How it's been going for me, it's been going well. I haven't got sick or anything, so everything all right.
it really changed us from doing like everyday thing, like going to school, had to go online. So switching from being in person to online, and then having to go back online. I mean, in person is probably going to be a big struggle, I feel, just for myself. So I know it's probably for other people too.
I think that we as the people need to do a better job of making sure that we wear our masks, social distance, and sanitize our hands, and also follow other protocols in place. There's a lot of issues with people doing that and having the mask underneath their nose or being too close to people and not having a mask at all. So I think we can do a better job of making sure that we follow those protocols.
I'm from New York. So back at home, I'm accustomed to different cultures. So I have a lot of Hispanic friends. I have a lot of Haitian friends, Jamaicans, X, Y, and Z. They all feel, and some people, they feel that the COVID-19 is a bunch of nonsense. So No, I wouldn't say it would be just black people. I feel like a lot of people is on social media and they get a lot of their viewpoints from different areas and they just coming together, you know.
Yeah, because I hear a lot of people talking about, you know, the Tuskegee. Yeah, that one. Yeah, a lot of my family talk about that. They talk about the government, but, you know, they talk about phones and stuff, too. You know, they wanted to track us. They put it in our phones. So, yeah.
Right.
I believe that's true because I think in the state of Alabama, we're actually in last place regarding vaccines in the country at under 50%. So I think we're very hesitant because I think we don't know, and we have the prior history of having certain diseases or certain vaccines inside of us, i.e. the Tuskegee experiment or the Tuskegee, was that what's called? It's Tuskegee experiment, and that causes a lot of distrust in the black community. And so we're kind of scared, I guess, to put an unknown injection into our bodies, and I guess that causes the reason why we don't want to get the vaccine.
CDC, my mother and grandparents.
Okay.
I definitely use the CDC website, and I also use news channels like Fox, CNN, and those various other channels.
Yes, it's a lot of misinformation. It's a big misinformation. First off, when starting off with the COVID situation, the misinformation of it was that it was a government-based disease. It came in the lab or whatever. People have their theories. Honestly, I just feel like you shouldn't believe everything that you may hear, see. Well, I say, yeah, you shouldn't believe everything you hear or see or read.
When the pandemic first came out, they was talking about how black people couldn't get it, and, you know, and then they talk about how the vaccine is doing all different types of stuff to your body and stuff, but I'm fine, so.
Yes, I'd probably say it increased. Washing my hands, wearing my mask, a lot of things, everything that's supposed to be done, I've been doing way more.
Washing hands, more sanitizing everything, sanitizing my clothes, all that has changed.
Definitely, I work at the Hornet Tribune's news station, so we're in there all the time, and we're always close, but what I do is I make sure I distance myself, and I always have my mask on, because sometimes my coworkers forget that we're in a pandemic, and they will sometimes put that mask underneath their mouth, and I always make sure that I tell them to put it back on, and I make sure they follow.
Certainly, COVID-19 has impacted the lives of people throughout the world, as 418 million people have been infected. Almost 6 million people have died. In the United States, the numbers are disproportionately high, as almost 80 million Americans have been infected. And we're fast approaching 1 million deaths caused or connected to the virus. African Americans have fared worse in the pandemic, as they are more likely to be hospitalized and slightly more likely to die. Why? What are the factors that inform this narrative? How can we sift through the different and sometimes contradictory information? How do we minimize the loss of life? How do we overcome this 21st century scourge? Let's turn our attention to our panelists to address these and other questions about COVID-19 and its impact on African American people. Our panelists? Well, okay. So we have our first question will be aimed at or targeted for Dr. Payne Foster. Dr. Foster, do you believe that African Americans are hesitant to get the vaccine? And if so, why or why not?
And I'm going to be talking from a study I did with a group of colleagues at the University of Alabama. But I want to first say I love the video from the students, because they really kind of confirmed some of the things we found as well. An ethnographic study we did in Alabama. Next slide. It was a large team. You see at the top left, Dr. Stephanie McClure was the PI. She's an anthropologist at the University of Alabama, along with several graduate students, another anthropologist, 2 public health professionals, actually 3 graduate, you see the young people are graduate assistants, and then a sociologist. Next slide. Our approach was really to do this ethnographic study, starting really before the vaccine was available. We used information gathered from an environmental scan done in December 2020. Also in October 2021, we collected data from county residents, essential workers, community leaders. Our methods were doing interviews, social mapping, diary studies, and focus groups. And we focused on 3 Black Belt counties, Hale, Perry, and Greene, and 3 non-Black Belt counties, Pickens, Tuscaloosa, and Bibb. And what we found, we really were focused more on African Americans in those majority Black Belt counties and some of the non-majority non-Black Belt counties. But the biggest finding we found was that there seemed to be vaccine hesitancy. This is along also with access to the vaccine. I think one of the students mentioned that early on. Many people wanted to get the vaccine, but they didn't have access to it, either because the vaccine sites weren't near them. If they were in rural areas, there may not have been broadband access. If you had to do internet appointments, but also hesitancy varied among different groups. Much higher in our younger populations. Older adults in this study seem to be much more wanting to get the vaccine rather than hesitant. Much of the hesitancy was fed by misinformation and also limited access to care. And it certainly reflects a variety of concerns and circumstances, including the historical issues that were mentioned about the U.S. Public Health Service syphilis study. So next slide. This was a quote from a 19-year-old vaccinated male. I had the questions of, like he said, is people that took it and still got it afterwards, So I was like, I don't have much faith in this shot thing, whatever. But like he said, with the allergic reaction, but I know people that had that. So although he was hesitant, he went on and got it, but he still had those hesitancies issues. We found that there were people on extremes, very wanting to get the shot or totally against the shot, and a lot of people in the middle, like this particular male, and he might have gotten it because either his job or his family really encouraged him. So we found that as well. So next slide, just our recommendation was to continue to co-host listening sessions with communities, particularly with those with low vaccination rates, to really identify and employ approaches preferred by target audiences, making respected local leaders the face of communication efforts, really assessing how the conversation is going. Because like I said, when we did the study, we had some people who said they were not going to get it. And then eventually over several months, they did change their minds. And that was based on getting information, more information, talking to other people who had gotten a shot, and also making vaccine access plans based on these ongoing conversations. We know that we have to continue to build trust with the public health system and communities, meaningful conversation with unvaccinated people. So not really being hostile and really pitting unvaccinated against the vaccinated. And then more people will probably consider vaccination and follow through with the decision to be vaccinated. And I think that's my last slide. So I hope that answers the question, Dr. Robinson. Yes and no. And it's somewhat complicated, but we have to continue to keep the dialogue going.
Sure. I want to turn to Ms. Barrow and ask Ms. Barrow, are there some unique factors that influence the way African Americans view the healthcare system in general and COVID-19 really specifically?
Well, thank you so much for allowing me to address these issues on the panel. I, like Dr. Foster, love hearing from the students, and it will, it'll pretty much solidify what I'm speaking about today. I want to talk a little bit about the mistrust of the healthcare system before I get into the attitudes with COVID-19 specifically. But, and some of those same factors will apply, but, you know, Blacks have had a keen awareness of being mistreated, dismissed, even disrespected by healthcare professionals historically. They also feel this way about government. So we know that when there is fear or caution with regard to the healthcare system, it's rational. It's a very rational emotion. They've experienced bias in healthcare. This is a real thing. I've experienced bias in healthcare and had, you know, very, very bad results as I've experienced it. And, you know, there's a historic framework that the continuing practice of racism in medicine and in government policies, you know, there continues to be a negative view of our healthcare system. But the things that I've mentioned is, you know, the reason why, or are the reasons why. There are many disconnects in the Black community. The students mentioned a lack of access. And there's a lack of access even today with quality education. We deal with economic injustice, environmental injustice, and, you know, even safe spaces in our communities. We just have a lot that is going on, a lot of challenges in the community. And, you know, the lack of access to the vaccine from the onset when the initial rollout happened is no different from anything else and everything else that is going on in the Black community. So equal access for Blacks continues to be a challenge. And the only way we can address this systemic institutional racism in healthcare is to try to end it or at least mitigate some of it. So we can go to the slides and talk about the pervasive mistrust when it comes to COVID-19 vaccinations. So as I mentioned, you know, there is mistrust of the government. There is mistrust of the healthcare system, the vaccine, its effectiveness, any adverse effects that it will have. And like I mentioned before, everything else going on right now. We know that Blacks have been very cautious about medical technologies. And it was always, you know, mentioned as we're out in the community, the Tuskegee syphilis experiment. That is something that is very prevalent on the minds of Blacks in the community when it comes to the vaccine. You know, and we try to explain everything that happened with Tuskegee and how the vaccine and its development was a little bit different. And we talk about the Black scientists that had been involved in, you know, the development of the vaccine from the very beginning and played a major role in the development. So we try to address the attitudes when it comes to mistrust. But, you know, we also know about Henrietta Lacks and the cancer cell research, you know, doing the research at Johns Hopkins Research Center without consent from the family. So it's just a lot of these things that have happened. And it's not just those historical things that have happened. You know, everyone doesn't always look to Tuskegee. They don't always look to Henrietta Lacks. They experience these things every day. They may have experienced it last week, or someone in their family may have experienced bias last month with the medical profession. So, you know, we know that there are other examples where people have encountered mistreatment And so that makes Blacks skeptical of the vaccine. Historical racism. These are all things that play a big role in the attitudes within the communities of color. So, we've had questions that come from the community of, is this vaccine for us or is it for them? They want us to get this shot so we can open back up and go spend money, and that affects their bottom line. It makes their bottom line look good. So we've heard a lot. We've heard a lot of this, and it just echoes what some of the students had mentioned. The social determinants. We know that education, employment, things of that nature have all been impacted with COVID. And the vaccination, because more Blacks are on the front lines, they're more likely to be exposed. They're more likely to lose their jobs. So economics, that's impactful. And all of these things just play a role in how COVID-19 has influenced communities of color. So we'll go to the next slide and talk about the decision-making process that communities of color go through. Most are hesitant due to those factors that I previously mentioned, but there's a large segment of the population who have faced structural barriers. And, they may not be vaccine hesitant, but they may be vaccine impeded. They've not been able to access the vaccine, lack of eligibility at the beginning, even if some wanted to get the vaccine or felt like they needed it, they weren't eligible at the onset of the rollout. Lack of transportation. It's so many things that play into being vaccine impeded. The limited hours of COVID vaccination clinics. We also heard from the community, especially the disability community, of the limited access, the physical barriers that they encounter just to try to get the vaccine. So, broadband, internet, lack of internet, so that they couldn't get on, and they could not register to get the vaccine. So it's a lot of things that play a role. And sometimes when these things the barriers are there, people lose interest and they say, you know what, forget it. I'm not going to get this vaccine. We also, in the decision-making process, when we speak with community members, there are those that are vaccine indifferent. Most of these were our younger individuals who say, you know what, COVID is gone. COVID is a myth. COVID doesn't exist. So they're indifferent about it until people start talking with them and listening to them and listening to their concerns. Only then do we see that they move to the next area of the decision-making process. And that may be vaccine thoughtful. They may be, in the place of, you know what, I'm doing research, hopefully not Dr. Google, but they're doing research to find out about the vaccine, the studies that were done initially, who these studies were done on, and they want to wait and see what's going to happen with those who have taken the vaccine. Okay, next slide. So addressing the mistrust and the misinformation, we want to build relationships. We know that this is going to be very difficult to do, but we've got to try it. At the Alabama Department of Public Health, we know that, this mistrust is valid, and we know that we have to do a lot in order to earn the trust of the community. There had been an absence of public health or, public health providers in the communities for so long. And then you come in with this vaccine and they're like, you know what? You haven't been here. Why are you here now? So we have to take a lot of different approaches, meet people where they are. Like Dr. Foster said, no shame, no blame. But we have to meet people where they are. We take multimodal approaches to vaccinations. If it's a mass vaccination clinic in several counties, we'll do that. Mobile clinics in the community, that is another area. Pop-up clinics, churches. We need to engage these community organizations and faith-based organizations, places of business. We've done in-home vaccinations for homebound population, and barbershops and salons. We've also engaged in partnerships with universities. So these are some things that, you know, we have to do in order to meet the need and encourage people to trust that this vaccine is safe. We do COVID-19 listening sessions in various places. And a listening session is basically just listening to the concerns and addressing those concerns so that individuals have the truth. They have facts that they can take and tell others about. And we utilize community health workers for that as well. Community health workers are trusted members in the community that would be able to educate and also encourage the vaccine. But we also, in addition to all of that, you know, follow the protocols as indicated by the CDC, mask up, distance, and definitely keep your hands washed. So, you know, we like to make sure that we cover all bases where that's concerned. Thank you.
Observations, and you hit on and touched on a number of topics, but I do want to move to Dr. Lloyd Davis. And Dr. Davis, you are here on the campus of Alabama State University and deal with the students, some of the students we heard from today. So tell us a little bit about what you're doing both on campus, but even beyond campus. I understand that the health center not only takes the responsibility to deal with COVID-19 at Alabama State, but moves beyond the campus and works in the community, the surrounding community. What are your office and your staff doing to sort of overcome vaccine hesitancy and to attack this disease?
Absolutely. So happy to be with everyone this evening. I hope that you're doing well. I am Joyce Lloyd Davis, and I'm the Senior Director of Operations at Alabama State University, and I serve as the Health Officer for the university. If we can put the slides up, then we'll go over some of the things that Alabama State University has been doing to address what we know to be true is that there are disproportional effects that are occurring during COVID that are affecting people of color. So if we'll go to the next slide, this captures what ASU's community efforts have been. So not only on campus, but what is happening across the community where we're playing an instrumental role. So early on, when COVID-19 over 2 years ago, when we were impacted by this virus affecting people in our community, Alabama State University went into partnership with the Alabama Department of Public Health, and we were able to offer mass testing for the community. So our program started as an outdoor drive-up program where you could come, and in a mass form, we would test individuals because we knew early on, before the vaccine development, that testing was pretty critical and that it was able to lend to people understanding if they were infected with COVID and to help kind of mitigate some of the risk and spread of the virus through the community. So we offered that not only to the Alabama State University campus family, but to the community. And then once vaccinations were developed and available. Then we had the mass vaccination clinics. And so we continue that effort to offer mass vaccination clinics. We started out through a partnership with Hyundai Manufacturing Motor Company of America to offer them to their employees, to their workforce, the opportunity for vaccinations. We likewise did the same thing with Montgomery Public School System. And then we went into a partnership with the Montgomery Housing Authority, which is my third bullet, that we created access to vaccines and testing for the Montgomery Housing Authority, which this group of folks were individuals who were in underserved areas that were being affected, by COVID-19 and didn't have access for so many different barriers associated with those individuals. So we created access to people who were underserved, underprivileged, people of color, so that they would have access to those vaccines and to testing through Alabama State University, through our stationary clinics that we have on campus, and through some of the mobile setups that we've been able to do in the community. We also have provided a vast amount of education on health risk and comorbidities that are, pre-existing to COVID. And then after one is infected with the virus, taking a look at what that health picture looks like and directing them to their primary care physicians in the community or to their healthcare providers for follow-up in that fashion, because education is a big piece of understanding what your health risk profile looks like and what you need to do from a preventive standpoint. So very proud of the university and our efforts to provide that type of education. We continue to offer vaccinations and testing on site to our Alabama State University family, as well as through scheduling with COVID support. We're able to continue to extend the effort in the community to offer all vaccines, the Moderna, the Pfizer, and the J&J on our campus. And we have the different modalities of testing as well on our campus. And that last point I was going to say is that we're really proud of now. We will be hosting an HBCU medical symposium that we went into partnership with Moderna. And through this partnership, we are targeting the leaders of organizations and companies in our community so that we can provide them information on understanding where we are in this pandemic and what our future needs are. We have a panel of experts who are going to be able to talk to us in this free symposium that will be offered either in-person option or a virtual option, so that again, and the goal is to get the leadership in the community access to this information, not only being a part of the symposium, but to walk away with digital access, hard copies that they can take and then funnel down to their workforce in their organization, or to the individuals who are part of their organization, or people who are a part of the network that these leaders represent. And so we think that's very critical, that's very important, and that is a huge effort that Alabama State University is doing to help combat some of these things that we're seeing as a result of COVID, particularly the disproportionate effects that are happening across our nation. This is a pilot program which will be again hosted on our campus, but through the efforts of Moderna and other partners, we want to roll this out across the nation so that we can provide this type of forum to provide this type of information. Next slide. So the social determinants, I know were spoken of briefly earlier, but I just want to highlight that that is one of the largest areas that through our work at Alabama State University that we have been able to understand why things are disproportionate when we look at people of color, because we look at the physical environment. Oftentimes, you know, when you look at your physical environment, you look at, you know, housing, you look at those areas that are highly populated with increases in cases of COVID. Are these congregate living areas? You know, so we have to look at our prisons. We have to look at our campuses. We have to look at areas where, you know, our nursing home, where there is congregate living again. And then what do those numbers look like when you break them down in terms of ethnicity? Do we have higher proportions of people of color in many of those areas? Is that an increase for the numbers that we're seeing in terms of the rate of infection? So we look at that. Then we look at access. Is there access? Transportation and access are right there together. You know, do they have access? So is there the need for more mobile clinics, or putting them in areas or communities where people can have access to it? Because we all know that transportation can be a huge barrier when we look at health disparity in general, but particularly when we look at COVID and we look at some of these, you know, disproportional effects that we're looking at. Those are two major barriers that we want to try to help eliminate, is the access and the transportation piece. And then, of course, job conditions. As mentioned earlier, we have to look at who are our frontline workers, who are the essential workers. What are those large proportions of people who may be working in the grocery stores that didn't close, you know, during the pandemic? People who worked in the hospitals, people who were our firefighters, our police officers, you know, those operations that did not close any during the pandemic. So we have to look at that. Our factories that continue to operate, you know, and who's working in those factories. Let's take an ethnic look at that. Let's look at age. Let's look at all of those things, you know, that we can assess from a demographical standpoint, and we could break down and draw some conclusions to, again, why we have this disproportional effect of COVID-19 being spread in our communities. Then we have to look at income, and income, because income also, you know, creates access. When we have healthcare issues, you know, can you afford your medications? Can you afford the treatment? Again, can you afford the transportation to go? You know, it plays a major role in that. As well as education and literacy. You know, education, simply understanding what the virus is and how the vaccine works. That will help us break down some of the barriers by providing the education. A lot of people don't know that Dr. Corbett is a immunologist, Black scientist, who led the efforts with the development of how messenger RNA would work for the vaccine at Moderna. So do people really understand that? Do they understand that messenger RNA does not alter your DNA, that it actually doesn't go in the nucleus of your cell? These are things that we have to surmount and able to have people understand why the vaccine is safe, or why we need to dispel some of these other myths associated around the vaccines. Then, of course, lastly on this slide, if we look at health disparities, when we start looking at those, again, disproportional effects, is because are there more people of color that are suffering from hypertension, diabetes, conditions that seem to worsen sometimes the outcome of patients who are positive for COVID? So those are things that we, again, have to look at, and what that impact has on our population. Next slide. And so some of the barriers that we've been able to identify through our work at the university is, of course, vaccine hesitancy. Of course, that's the big topic. But the vaccine hesitancy stems from the other bullets that I have listed here. That lack of information, the myths and the misinformation that is circulating, lack of education, and lack of transportation. These are major barriers that we have identified through the work that we have been doing in the community at Alabama State. And last slide provides some contact information for those individuals who may want to utilize our services in terms of having a vaccine or in terms of access to testing. Our health services email is listed there, as well as phone number, and the same thing for our designated COVID support line. We have a designated COVID support line for our ASU family, and an email when we are scheduling vaccinations or testing for individuals who are in the community. And we do welcome partnerships because we're on the forefront in the start of this fight with COVID-19, and we will continue the efforts to fight this virus, because we're in a pandemic, and we want to get to a point where we're at an endemic stage where we understand how to manage it, how to deal with this, and how we can move forward and gain a sense of normalcy again.
Okay, that was a very interesting presentation, and I think it raises a number of issues. One that comes to mind is that it seems like there are very different rationales for vaccine hesitancy depending on the population, and so it looks like you have to develop specific strategies for certain audiences based on what their barriers are. And I just want to ask that question across the board. It seems like that's a consistent theme in all of our presentations. Am I not right?
Yes, I mean, I would say from the project I presented and some others I'm in, one size doesn't fit all. We definitely have to have a really specific strategy. And for example, if we want to do educational sessions for the youth, we might have to make it a little bit more interactive so that they would come, or make some incentives there for them to come in the first place. I know at the University of Alabama, there were incentives to get vaccinated, money, other incentives, and even for programming. I know that's sometimes controversial, but you have to sort of meet people where they are. And so I think that's probably a good strategy.
I think another thing I heard, and I think is a very appropriate observation, and that is not being judgmental. So many people, particularly the people on the spectrum or the side of the spectrum that has really embraced vaccinations and have been quick to receive vaccinations, take a more judgmental posture as it relates to those folks who are on the other side of that spectrum, or even in the center in that hesitancy realm. And so I hear, I think, another theme that comes across in terms of really meeting people where they are, and then respecting, particularly as we talked about some of the context for the specific context for African American hesitancy, and it being steeped not only in historic actions, but also being steeped in contemporary experiences that reinforce this notion. And so you have to. It seems like you all are sort of internalizing that and developing strategies to take that into account.
Yes, and I'll just say, for the Alabama Department of Public Health, we have to be very intentional about how we implement and employ these strategies. One successful strategy for a lot of community members has been listening sessions. We, have done these sessions for workplaces, fraternities. And during these listening sessions, you know, we can take it from the listening session where you have a medical professional there, trusted members from the community to address concerns. You know, we steer away from calling them myths, but we call them concerns because they're valid. Whenever anyone has, you know, a concern about the vaccine, we want to address it. We want to give them facts. And then once we're able to give them the facts and answer those questions for them, we want to also provide opportunities for the vaccine. So it may be that we will have people on site at a designated time to provide the vaccine and do testing as well during that period. So, you know, we take them from, you know, one step to the next. But, you know, in all of it, we make it accessible. And we also adhere to any kinds of physical barriers. Everywhere that we go, we make sure that there will be no barriers for individuals with disabilities. You never know who you're going to encounter. You may have to have American Sign Language providers, their interpreters. You may have to, you know, have someone there or a room that's silent for someone with sensory disabilities. You may have to speak in plain language or have a plain language board for individuals who have cognitive or intellectual disabilities. So, you know, we have to be prepared for everyone that may come through for those vaccines and that testing.
We have I believe we have a few questions that that are coming from our audience. Can we see those questions? And I don't. Okay, here we go. What can the average person do to help combat the misinformation that is circulating in the African American community?
So I think one of the things that I'll just, you know, speak first to that. One of the things that we've shared with many of the individuals that we are providing, you know, vaccines to or that we're testing and they have questions about vaccine is I encourage people to, you know, read and follow the science for yourself. I think, you know, CDC, of course, is a very resourceful website, and you can go to the CDC website and it's very easy to follow information. There's not a lot of, you know, fancy medical terms. They've done a great job of having information, you know, particularly on the vaccine. They have a myths section that you can look at. They have a section that addresses misinformation that's circulating in the communities. And it's very, again, user-friendly for you to understand. But I also encourage people to go to the vaccine sites, to go to Moderna's website, to go to Pfizer's website. And that's where you can find information about the studies that are ongoing or the studies that have occurred. I'll particularly mention one. There's the COVE study, which was Moderna is still, they have results from the early phases of the COVE study, and I think they're in their last phase of the COVE study. But what was particularly interesting about the COVE study is that they were very selective in diversifying the population that participated in that study. They were very cautious to make sure they had a good number of ethnic people of color. They were very good about making sure that they had people of a diverse age group, diverse backgrounds, you know, social economic backgrounds. So if, you know, you particularly look at that, pay attention to that, read that, see it for yourself. So I encourage people to do their own research, and you can go to those reputable sites and find that information.
Sure.
And I think looking at local sites, of course, the ADPH website, they also have a COVID vaccine site, and I say keep up with it because it's changing so quickly. But I also think talking with people who understand the science, physicians, healthcare providers who do understand the science and translate that to their own family members in small circles, I got many a call from people who just really wanted to sort of understand what was going on, the science around it. These were people who just called my cell phone friends, family members. I think those types of information sharing are also just as important.
I do want to say, and I think we have one more question, but one thing I'm really interested in is your observations about what does a post-pandemic America look like? How do we know we're past the pandemic phase, or I guess you're saying we're in the endemic phase, but what does this look like?
Well, I think we're going to have to think about mask wearing at different times. We just removed the ban at the University of Alabama on Monday, but as if a new strand comes out, we might have to adjust. I think being flexible is what a pandemic, post-pandemic era looks like. I certainly think one of the things I did want to get in, Howard, is that our ground game around really dealing with pandemics needs to get better. I think it needs to be strengthened. And some of the things that Ms. Barrow talked about, we should be continuing those in the future. Certainly, community leadership should be a part of public health and how we can really engage with communities better and quicker and faster to really deal with some of the inequities. We need to continue to do that.
Yes. Any other observations? Any other observations about a post-pandemic world in America?
I'll tell you one finding. The third finding we had in our study was the community was very concerned about the COVID educational slide for their students, K through 12 and higher ed as well. So I think we're going to really have to really attack that. One of our recommendations was to have a statewide committee really deal with the educational system, because that is health and well-being. So I think that's a major issue as well.
Yeah, I think that there's been some evidence that people, educational attainment for a lot of people in secondary school has suffered as a result of the pandemic and disruption to in-person learning. And that's another thing. I think that this gap, the technology gap and the inaccessibility of the internet in many places, there has been, I think this is exacerbates or illustrates the need, to address those types of issues.
Most definitely.
And we've learned that there are some things that lend themselves to an online format, and there are some things that do not.
Right. And I will also say just quickly, in utilizing our federal grant dollars in a very strategic way. I agree totally with Dr. Foster in staying in the community, the ground game. It makes such a big difference. But, we also need to invest more in community health workers. That model has been around for years. We've called it so many different things, lay educators and the
child health advisors. Yeah.
Yes. So I think, investing in our community health workers and keeping them on a path where, if they feel like they want to be a part of the medical profession, they can take that path, but provide the necessary tools for them to do that. But utilize them as much as possible.
Right.
And I think I was going to add that I think, post-pandemic, of course, we'll have to deal with some of the residual effects, and we'll have to look at, some of the residual financial effects for individuals, organizations, and businesses. Is something that we'll have to take, a close look at. We'll have to look at, organizations that have been affected and how they rebuild, coming out of the pandemic. And then also, from a health perspective, of course, we started out at the height of, this pandemic, and then now we're dealing with the variants. And when we can eventually get to a place where we're looking at endemic and we look at, this being a seasonal approach, I think scientists are, currently looking at that to how we manage this virus. Because, COVID, it is a virus. And so there may be a seasonal approach, to managing that as we get closer to a place where we're either going to go to herd immunity or we're going to get to a place where, the virus becomes much more manageable, based on the infection rate of people who are positive and their response, to those variants.
Well, I'd like to take this moment to thank our panelists, Dr. Lloyd Davis, Dr. Ms. Barrow, and Dr. Payne Foster. This has been a very sort of informative and enlightening program. I'm just delighted that we were able to bring this type of information to our constituents and our audience. Thank you for your observation. I think that we have sort of fleshed out a number of themes, in terms of these varied and specific approaches, in terms of meeting people where they are, in terms of, really the pandemic has illustrated our need to address some of the really systemic issues in our healthcare, particularly the perception of our healthcare, in some of our communities. And so that there in the future, there isn't this sort of storm of various ideas and opposition that make managing a pandemic like this so difficult in the United States. So I want to thank you. I want to at this point thank our guest and the people who have submitted questions. We have closing remarks from Dr. Janice Franklin, the Dean of the Levi Watkins Learner Center and the ASU Project Director for the National Center for the Study of Civil Rights and African American Culture at Alabama State University. Dr. Janice Franklin.
On behalf of the National Center for the Study of Civil Rights and African American Culture at Alabama State University, I want to thank all of you for attending this year's Black History Month program with a special focus on the health and wellness of African Americans. We especially want to thank our program participants, including the distinguished president of Alabama State University, Dr. Quentin Ross, and our prestigious guest panelists, Dr. Joyce Lloyd Davis, Ms. Felicia Barrow, and Dr. Pamela Foster for their outstanding contributions to today's program. We are indeed grateful for the information that our experts have shared in examining the challenges facing our community during a global pandemic. We also appreciate the very timely responses from our students at ASU, who helped us gain further insight into how this pandemic has affected their lives as our future leaders. In closing, I would like to thank our provost, Dr. Carl Pettis, and staff members in the Office of Academic Affairs for their support. We are indeed grateful to our host, Dr. Howard Robinson, for his outstanding contributions as historian and program facilitator. The success of this event is due to the outstanding work of our National Center staff, including Dr. Dorothy Autry, Ms. Bradley Petway, and the members of our steering committee, whose names you will see listed in our acknowledgments as we close today's program. Once again, I would like to thank all of you in our audience for your attendance and ongoing support. We are happy to have presented this special celebration of Black History Month that is in keeping with our mission as a Center for the Study of Civil Rights and African American Culture at Alabama State University, the university at the heart of the modern civil rights movement. Thank you.